Hi guys, my name is David, and I'm going to go over my patient care presentation with you. So for my topic, I got patient education self-care programs. So what is it? What is a patient self-care patient education program? So basically, it's a program that consists of data and information on cardiac physiology and anatomy, risk factors for cardiac heart failure, diagnosis and symptoms, disease management, exercise and diet, medications along with their side effects, and blood pressure monitoring. So it's just an array of data that helps inform you better about health-related symptoms that could lead to disease or injury, so that way you can prevent future injury or disease or cope with future injury or disease once you're diagnosed with it as well. So here we have two diagrams. One is self-management on basically what a patient, decides to do, uh, certain decisions that help affect their health, and the basic external and internal factors. So there's a lot of different things that influence how a patient makes healthcare related decisions. So self-care patient education programs can enhance this and improve the overall quality of how they handle their health, and maybe prevent certain injuries or diseases. So over here in section B, we also have, the basic components of educational programs. So exercise advice, which helps you, be more active. If you're more active, you're going to reduce the risk of a lot of diseases, especially heart disease, having to do with, obesity. Cognitive behavioral elements, multidisciplinary pulmonary rehabilitation program. So that has to do, with your heart and all kinds of pulmonary diseases as well. Ongoing clinician and nurse support, as well as optimization of care plans. So helping you formulate the best plan. It's going to help you, stay healthy as best as you can. Research evidence. So these are the different components of self-care education programs that help, solidify it in terms of research and data. So if your if your data is sound, and this is the levels of research based on self-care patient education programs, you're going to impact someone's health, their health disparity, and then uh, as well as their financial status. You're also going to improve the economic status of the employer as well as the employee, because more people are going to refer a certain clinic. You're going to save money uh, based on the patient, because they're going to come in less. They're going to avoid certain injuries and not have to be billed so much from being hurt or having certain diseases. Then of course the employee is going to benefit, because if they do implement certain self-care patient education programs, uh, they're going to be recognized as a good employee as well. So everyone benefits and more money in their pocket as well. So these are some examples of research evidence. So there was a randomized clinical trial that was conducted by Doris. It was based on a specific healthcare, self-care, self care patient education program. It had a huge impact found on effectiveness and cost effectiveness in an empowerment-based self-care education program on healthcare outcomes in patients with heart failure. So basically, programs related to heart failure help educate them better, prevent it, and help them take care of their health better from heart failure perspective. Also, self-care education programs have been directly linked to positive cardiovascular results. So that would have to do with lowering blood pressure, increasing hypertension related knowledge. So, they educated themselves better and knew a lot more about hypertension. And enhanced competence, which is understanding in hypertension self-management behaviors. This is basically just, how can they act in a certain way that's going to improve, their health from hypertension, from a hypertension perspective. Also, self-care education programs have been proven to increase medication adherence. So you're more than likely to take, the correct medication and are more than likely to take your medication because a lot of patients don't. Self-efficacy, self-related health, cognitive symptom management, you're more aware of your options and your surroundings from a health perspective. So that way you can, make better decisions. Frequency of aerobic exercise, again, improving your overall health by exercising and getting in the gym more. And then depression through numerous researches, because depression is directly linked to health. If you feel better about yourself, you're probably, in a better health state. So from an economic perspective, in terms of health model estimates, there was an estimate, but not an actual cost, you know, data evidence that health systems could possibly save $3.9 billion nationally if 5% of adults with one or more chronic conditions were educated according to a self-management education program. So this is just an estimate, not an actual, crunch on numbers of how much the healthcare system could save nationwide. Also, from a race perspective, African Americans and white Americans both have been positively affected by self-care education programs through, different various studies. But also, there has to be more research that should be conducted to focus on other races as well as other ethnic populations and income populations, particularly in the low income population bracket, because people with lower income are less likely to seek health care because they are afraid of getting billed for money that they do not have, and they're not aware of the different, options that they have as far as programs to improve their health. Examples in healthcare. So the Journal of American College of Surgeons, they conducted their own research uh, based on self-patient education programs. So they were trying to transition, normal patients into a self-care education program. They conducted, research using a control group, people that didn't have any, education as far as their health or do not have any program implemented versus someone who did. And then they compared the outcome. So the goal was to improve overall health outcome, public health patients by empowering them with knowledge. So, better educating them on how to manage their well-being. Also, patient self-care education and support has been applied and implemented to different community and clinical settings. So this would include the YMCA, federal qualified health centers, and managed care health systems. Patient self-care education programs were also introduced to women in a specific study, women diagnosed with breast cancer-related lymphedema. This was implemented by physical therapy specialists and physiotherapists. So the purpose was to reduce the risk factors of this diagnosis, as well as apply certain self-care to patients that already had the diagnosis, went through surgery, and were going through some certain effects. So they're trying to reduce specific effects as well post surgery. Clinical implementation. So these are the three different brackets that have to do with self-care. So you have your self-management decisions that you make, self-testing, as well as self-awareness. Are you aware of your health and how to, prevent certain diseases and injuries, and how to handle certain diseases and injuries once you have them. So clinical implementation. So I would say the biggest factor would be resources and tools. That would be the biggest thing. So health department agencies can refer patients to self-care, self-management programs. So referring people to, getting educated on the different programs that are available at your clinic. The CDC also has tool resources that are designed to help patients search for self-management care educational programs in their own communities. So one in particular would be a program called learn more, feel better. So again, these healthcare implementations also do involve, athletic training. That would be, the main focus for us here. Um, there's different programs out there. There's a lot of resources. You just have to find, what available resources you have in a specific area. According to NATA.org, athletic trainers should teach patients and implement self-care education on a day-to-day basis. This is implementing, so you have to teach them and you have to implement self-care education, and then you should connect them with programs and resources. These are, self-care education programs that are going to help better their knowledge. So this is going to improve patient outcomes, prevent injury, as well as re-injury. And then it's going to provide a return on investment, again, for employers as well as employees. So the goal for a clinic is to provide a source of health awareness, understanding of themselves, cognitive awareness, so that way a patient makes better decisions and prevents disease, future disease, as well as handles present disease as well. And that would be it. This is my bibliography with my cited sources. Thank you.